Alrighty, I think we can go ahead and get started. It's 11 o'clock Mountain Time. So I'm Maddie Gustafson, and I am a project coordinator at the National Environmental Health Association. And I'd like to welcome you to the first webinar in our 4-part Data and Environmental Health webinar series. Just a few Zoom reminders before we get started. If you have any questions throughout the presentation, please submit them to the question and answer box, and we will get to them at the end of the presentation. Any other inquiries, please send them to the chat feature. So to kick off this webinar, I will hand it off to Sarah Schott.
Thanks so much, Maddie. We're excited to get started today. We've got a great guest speaker for us. We have Tyler Kleykamp from the Beeck Center, and he could tell you a little bit more about himself. We've got a great presentation for him. I'll then have a couple of questions for him, and then we will move into Q&A from the entire audience. So let's get started. Thanks, Maddie.
Hi, I'm Sarah Schott, and I'm the Open Data Standard Consultant to NEHA. We are in our series on open data and open data standards for the environmental health community. And today we're so excited to have with us Tyler Kleykamp. He is with the Beeck Center, and I've known Tyler for several years. And he has always been this amazing expert on open data. He's going to tell you a bit more about himself, but really this is to give us more foundational knowledge on open data, what it is and what we mean by some of these terms and best practices around open data. And Tyler's one of the best people in the United States I could possibly bring to you. So we're really honored to have him here today and have his knowledge shared with the NEHA community. So thanks to NEHA for facilitating this, and Maddie for being here, and works with us on the CDC's and NEHA's Open Data Standard Project for aquatic inspection data. So really excited to have you all here, and I'm going to turn it over to Tyler to present. We'll have a little Q&A after. Thanks.
Awesome. Thank you so much, Sarah, for that wonderful introduction. I just want to say hi to everyone so you can see my face before I go ahead and start sharing my screen. So my name is Tyler Kleykamp. I'm going to go ahead and share a few slides with you as we talk about open data. So before we kind of get into what open data is, I thought it would be helpful to maybe tell you a little bit about myself. So my name is Tyler Kleykamp. I work currently at the Beeck Center for Social Impact and Innovation at Georgetown University. But before I did that, I was a career government employee for the state of Connecticut. And I actually started my career with the Department of Public Health there, working on drinking water supply issues, actually. And basically, I did a few different things within the Department of Public Health, most of which were related to leveraging data as well as GIS technology across that agency. And I eventually made my way to what's called the Office of Policy and Management, which is Connecticut's version of a budget office. I did some work during the American Recovery and Reinvestment Act out of the governor's office. And then toward the end of my career, I was the chief data officer for the state of Connecticut. I was the first person to hold that title in Connecticut and one of the first people in the country to actually be a state chief data officer. And really most of my career involved taking things that you see in the middle of this slide and turning them into the things that you see towards the bottom of this slide. So that could be maps or charts or reports for the public, for policymakers. And so I spent about 18 years gathering data, sometimes on paper, sometimes digitally, from maybe within my own department or across other departments, to do some form of analysis and do work to inform the decisions that policymakers would use. The Beeck Center itself is a little bit different than traditional academic centers that you see across universities. We're actually located in the provost's office at Georgetown. And we're really focused on identifying solutions that we see working in different places and then trying to scale them across various networks. And we do that through two portfolios, Fair Finance and then Data and Digital, that I'm a part of. And so a big part of what we do as well is engage students to help educate them to be future leaders in the various spaces that we work in. And so they're not coffee fetchers or copiers or filers. They do real work, real research, real interviews, real writing alongside us as well. So let's get into open data a little bit more, because I think sometimes we think of open data and open government and government data as these interchangeable terms, and often that's associated with simply the word open. And so this is a great Venn diagram that was put together by a gentleman named Alex Howard, where I think this articulates what open government data is. It's sort of this intersection of a variety of things. So if you think about open government, it's not just data that makes government open. It could be open meetings, it could be open records, it could be ensuring that documents and emails are accessible to people. Government data, not all of it can be open. Much of it is actually protected by various laws, but there are sets of data or versions of protected data that can certainly be shared publicly. And then open data isn't limited to government data itself either. So an example of this might be if you use a service like Kayak or Priceline when you used to be able to travel. Those platforms actually use open data from whether it's the airlines or hotels to help you find good rates on whatever service you're looking to acquire. And in turn, they provide a service back to that particular company by helping you book your travel. So it creates sort of a mutually beneficial relationship for both the company who's providing the data, the provider who's providing you with maybe the experience that you prefer when doing that type of travel booking, and then ideally for you, because you have an opportunity to not have to go searching across a bunch of different websites to find the best rate for what you're looking to do. Another example where probably open data affects you in your daily life is weather. Anytime you go to check the weather, that's powered by open data and actually open government data provided by the federal government. So open data, I think, as we mentioned, or as I mentioned, is often conflated with open government, but it's largely more of a technical term, at least in my opinion. And it's really two things, primarily. One, that it's legally open. So that means that it's something that's not protected by either a state or federal or maybe even local ordinance. And I've cited a couple here, the Family Education Rights and Privacy Act, HIPAA are popular ones that people are familiar with. But there still are versions of those protected data sets that could be made public as open data. We call that aggregating or de-identifying it. But basically, you can't share records about individual students online, but you could say, provide student test performance in general terms, whether it's broken out by grade, could be race, but again, you can't provide that individual level. The other piece of this, and this is especially applicable within government, but also the private sector, is that there's no license or terms of use attached to it that's at least restrictive. And so what we mean by that is the private sector may release data and then it's licensed to say, well, this can only be used for a very specific purpose. Oftentimes government may release data under some type of term of use that says you can only do certain things with this, such as you can only study the impacts of water quality with this water quality data, but you can't potentially use it to understand, I don't know, migratory bird patterns or something to that extent. not that those are in practice, but that's sort of an example. And so when data are provided to the public, they shouldn't have something that is restrictive in terms of what people can or can't do with it. The other major component of it is that it's technically open. And by that, the term is generally machine readable, and that means that it can be read, manipulated, analyzed by a computer and computer software with minimal to no human intervention. And so oftentimes governments and public agencies will release, we'll call them Excel spreadsheets, but they've converted them into a PDF format. And what that means is that it can't be read then back in by a program like Microsoft Excel so that somebody could analyze that data. And a lot of the reasons that these government agencies and public agencies do this is because they want to ensure that the product they're putting out there can't be modified or changed by individuals. But in today's world, we'll see people trying to copy and paste data out of those that sometimes actually can be prone to errors. And there's other technologies that allow people to extract that data from it. So it's actually better in many ways to just provide data in a format that's much more useful for that. And then ideally, open data would be available publicly on the internet and no fee for use or anything to that effect. So a lot of times in the public sector, we see information released and data released like this example on the top. And so for this happens to be municipal spending data. This is useful to some people who have a very explicit, they want to go and look up their own community and how they spend money on different things. But there's a whole other audience of people that would much rather work with something that looks like the example below it, where that data is in more of a raw form and has a level of granularity and utility that isn't available through some of these charts. So if they wanted to understand and compare say multiple communities in this instance, they'd be able to do that without having to click through a bunch. They can leverage their own tools and skills to be able to work with that data in a way that's much more meaningful to them. So why would we want to make data available? One of the things we hear a lot as a criticism of government, especially in the age of COVID now, are that we're seeing these dashboards and products being released, but people don't really have the opportunity to understand some of the nuances of the data that's going on behind that. I would also add that in many ways, at least based on my career, it helps government out itself. Think about probably in your day-to-day business, how many times you might be emailing a spreadsheet of something to another coworker, or be emailing another department looking for some type of spreadsheet. And so the ability to have that data in an easy to access place that can be searched, retrieved with minimal sort of requests going back and forth. It saves time, it saves money, it saves effort. It gives government itself an opportunity to kind of understand what's going on across agencies and departments in a better way. And then from the public side, it sort of helps build trust with the public. They know that they're able to get something that they're looking for. When they email someone, it doesn't go to the bottom of the list. And we're seeing a tremendous amount of public interest in taking data that government provides and developing new and innovative solutions to problems. And what we rarely see are gotcha moments where public agencies release data and somehow it's weaponized back against that agency. Sure, people may find things that areas where government could improve the way they do things. But for the most part, we're seeing new solutions to problems or new ways to deliver information to constituents that typically government hasn't been able to do before. And so I always share this slide, and it can be a bit hyperbolic to say the world's most valuable resource is no longer oil, but data. They are very different things. But this piece from The Economist highlights a piece where in this day and age, we're seeing a real monopoly over data in the private sector through companies like Amazon and Google, who have a tremendous amount of our own personal information and what we buy and what we do and where we go. And the argument here from The Economist is that governments and agencies could actually encourage the emergence of new services by opening up their own data, especially as it relates to critical parts of the economy and public infrastructure. So in a weird sense, government has an opportunity to be somewhat disruptive without the force of regulation here, simply by injecting a new form of competition into the private market. And so as I mentioned, while oil is a type of asset, you may also hear the term managing data as a strategic asset. And it is a strategic asset, but it has a different way to be valued than traditional, more tangible assets. So typically, we look at assets and their value in two ways. Here we're using oil prices from as sort of the supply of oil increases, its price decreases, its value decreases. And when the supply of oil, when the supply of oil increases, its price decreases. When the supply of oil decreases, it becomes more expensive and more valuable. Conversely, we value things based on how we use it. So when you purchase a vehicle and you drive it off the lot, it immediately loses value, and its value continues to decline the more it's used. So the more mileage a car has on it, the less valuable it becomes over time. But data is valued very differently, and its value can be measured very differently. Essentially, the value of data increases exponentially, both with the amount of data that exists and with the amount that it's used. And so what I mean by this is, if we have, let's say, a data set of drinking water supply wells, private drinking water supply wells, that has some value potentially to you as environmental health practitioners. You'd want to know who's on a private drinking water supply, maybe who's on a public drinking water supply. If there were, a hazardous material spill, it would help you quickly identify, what the impact might be to residents in the vicinity of that supply. Similarly, it's hurricane season. That same drinking water supply well database or private well database combined with, let's say, flood zones gives you a picture of where wells might be in flood prone areas, if they're even allowed to be there, based on your regulations. But in order to prepare for where bottled water might need to be supplied in the event of a catastrophe or something like that. So the idea being that we derive more value from each of these discrete data sets when we're able to put them together, combine them into new information, insights, and action. And so as we continue to increase our availability of data and we use it more and more, we get more out of it, and it becomes more meaningful and valuable to us all. And that means that we need to start providing data as open data in different and more meaningful ways. And so I use these three examples really, of the way we typically see health and disease related data. Specifically, we see them released as charts in this instance, and also in choropleth maps, or these color-coded maps. And I point out the map instance in particular because when we represent information according to effectively these sort of arbitrary boundaries, it paints a picture that maybe one geographic unit is worse than another geographic unit when these things actually happen in discrete locations. So as an example, the community that I live in has a main road, and the road is actually the boundary between two different towns. I'm in Connecticut, so everything's called a town here. On one side of that road, we have a mall and a Home Depot and some places like that. On the other side of that road, in the other community, there are other shopping plazas like a Target and places like that. And so what happens there is, as you might imagine, there's a pretty high occurrence of car crashes that are a result of the traffic in the area and different things. And essentially, depending upon which department responds, that traffic accident is reported within that community. And so, as you might imagine, those numbers, being attributed to one community or another might make it appear that just by virtue of living in that town, there's a traffic safety issue, when in reality it's a circumstance of a very localized problem. And so providing data in more open and meaningful ways helps people better understand the phenomena that are going on versus putting out things solely as maps. So these maps and charts are great for people who may want some additional context or don't have the resources to dig deeper, but there are a lot of people who want to figure out what's going on behind those maps. And so accompanying these types of things with the data that support them in sort of more granular ways can really provide additional value both to them, but also to your mission. And so when we talk about raw data, I think it means different things to different people, and especially in a public health context. You can see on the left here, we have sort of the least flexible example of how data are aggregated. And then as we move over to the right, we're seeing that it becomes more and more sort of specific in terms of, we're seeing quantities purchased by year. And then as we continue to move over, now we're seeing the specific purchase that was made. So the more raw you can get, as they say, the more useful the data are. If you can't provide the example on the right because it involves individual information and maybe that's protected by some type of law, then maybe you can provide something more like this middle example, which is more flexible and more useful. And even the example on the left is helpful if it were released as open data and not just a chart or a graph or a map. And so putting this into sort of practice, right? And especially I think in a public health context, one of the great examples that I can think of in terms of positive impact is an initiative called Smoke Signals. And what this started with was, it started in one city where effectively they were able to take open data about fire incidents that occurred in those communities. And so when fire departments respond to fires or other incidents, if it involves a fire, they collect whether or not there were smoke alarms present or whether the smoke alarm was activated. And so a group of data scientists, although this isn't the type of effort that actually would require strong data science skills, was able to take data on fires where no fire smoke alarm was detected or went off. And what they found were some basically trends associated with areas that did not have smoke alarms present when the fires went off. And they combined that basically with census data to look at the age of housing stock and some demographic information. And they found areas that were more prone to not actually having smoke detectors within a lot of the dwellings that were there. And so what they did with this information is I don't know if they still do this program, but they used to do a program at fire stations where you could go down and they would have free smoke detectors that you could get. And it was up to people, right, to go down to the fire department and request one for free. And as you might imagine, the awareness of the existence of that program is probably not widespread, or people just because it was time out of their day or whatever, maybe didn't think to do it. And so what they did was then they sort of reverse engineered that, where they went out to the communities that were more likely to not have smoke detectors, and sort of asked and distributed smoke detectors to that community. You can see this in New Orleans. Within the first year of doing this program, they believed they were able to save at least 26 lives by doing that. And so that's the potential that exists across a number of programs, including things like restaurant inspections, where by making restaurant inspection data more openly accessible, companies like Yelp will pick that up. And so that really does two things. One, it helps inform the consumer before they actually show up what the sort of restaurant inspection showed and what the grading system was. But two, then it puts additional pressure on those companies to ensure that they're being compliant with inspections the next time, so that they're not turning off prospective customers, because now that that information is easier to access, right, it enhances their desire to be more compliant. So what should you be publishing now that you're interested in publishing open data? Some good places to start are simply, do people ask for it? Either formally or informally. So is this something that people just keep emailing you asking for? Or does somebody pick up the phone and call you? Or maybe even through something more formal like a freedom of information request. So the short story is, if you get a freedom of information request and somebody tells you you have to provide that data, why not just then publish it on your website so other people can have access to it? It's been established that it's of interest and that it's a public record. Might as well just put it out there for others to use. Are there reports that you submit to, maybe it's a legislature if you're a state agency, or maybe a town council if you're a local agency that uses data, right? So if you provide that sort of raw data behind those reports, it's likely that that information is important to people, because otherwise they wouldn't be telling you to put it into the report. And others may have interest in this too. Three, I say this in a sense, is really, is it used for some form of decision-making purposes? So when people are applying for some type of license, permit, or credential, these are things that have tremendous public value. So whether it's things like septic permits or building permits or restaurant permits, licensed childcare facilities, these are things that have tremendous public value, so that people know that either work is authorized, the individuals are authorized to do the work. It helps people kind of understand in a more broad context, are there gaps in certain areas? It could be something like a gas station permit. Those gas station information is useful to both environmental planners as well as transportation planners. So permits, licenses, those types of things are of tremendous value to people. And even if even in some version, if it can't be shared at the sort of individual level, some form of aggregation is always helpful. And again, anything with an address or locational component to it, even if you're not allowed to share it. But location is incredibly important, especially in the context of open data. So being able to understand where things are in relation to one another, I'm sure, we tend to talk about the John Snow cholera map for not only open data, but my background in GIS. And so that was an exercise in kind of understanding, where things were in proximity to ultimately the well that was helping to spread cholera within the community. And so things that have location information, whether it's an address or coordinates, are tremendously valuable for a variety of purposes in the context of open data. And then finally, is it already out there? Is it something that you're just publishing? Maybe it's on your website, and it could just be made in more of a form that's sort of compatible with open data. So are you taking the list of inspections that you've done and putting those results out, but it's just in a PDF? air quality results, things like that that are already kind of being put out there, just make them available in a more accessible and open form. And so to get started with open data, first of all, you don't need an open data portal, no matter what people are telling you. There are a lot of products out there that have the ability for charts and graphs, and they cost money. You already probably have a website. If you don't, that's okay. There are other ways to get things out there, like through a Google Sheet or something like that. But it's really just about identifying a handful of useful data sets based on sort of the criteria that we looked at before. GIS data is a great place to start. Before there were open data portals, there were GIS portals. GIS practitioners, I think, realized long ago that it takes a tremendous amount of time and energy to create certain GIS data, and there became this sort of desire to share, understanding that they shouldn't need to recreate a data set that took somebody a painstaking amount of time to create. So GIS professionals are typically more than willing to make their data a little more easily accessible. You should have a plan, though. A lot of times people will put a piece of data out on the internet, forget that it's there, forget to update it, and that can be challenging too. So think about how frequently it'll be updated, by who, how, when they're going to do that. So in what cycle, maybe even what day of the week. And then you just sort of set up a web page and post your data sets in there in some type of machine readable format. Comma separated values are typically what open data enthusiasts prefer. If you want to do Excel, that's fine. GIS data comes in shape files or GeoJSON format. If you don't know what either of those are, just talk to a GIS professional. They'll be happy to tell you. But you should always include something that involves metadata, and that's basically a description of what the actual data set means. If the columns in that aren't readily understood, you should sort of describe what they mean, and then any limitations that may be contained within the data. So, is it potentially incomplete? Is it something that maybe more suitable for planning purposes, but not, I don't know, engineering grade data, especially when it comes to GIS. So provide some basic documentation about it so that people on the other end understand in advance what they're working with. So I think a lot of times public agencies use either acronyms or terms of art, or maybe there's just an assumption that the person on the other end is familiar with the vocabulary that you use in your line of work. And so just make sure that it's documented so that people can understand it in effectively layman's terms. So that's it for me. If you would like to get in contact with me, I'd be happy to chat. My email is there, and you can also visit our website, where we provide a variety of best practices, primarily for state chief data officers, which is the group that I work with in my current capacity. But a lot of the work that we're doing overall with data, we think is helpful to more local levels of government as well. So with that, I'm going to stop sharing my screen and welcome Sarah back.
Thanks, Tyler. Thank you for that. So I'm sure our community who are watching have a ton of questions. I have a couple questions for you to kind of kick it off before we transfer over to our live session with Q&A with our NEHA members. So one, I was going to ask you about, you mentioned the tendency of governments to put information in PDFs because they think that this is going to kind of secure their information and make sure that people aren't misinterpreting it and that sort of thing. But that on the flip side, there's tons of folks who need this information, need this as data, not a document. And so they're using tools to copy and paste that information off the document and have, that can cause some challenges. are there, there's governments and people who are probably on this session who are thinking, I would really like to be able to move from just publishing in PDF to having some form of open data for key components of our environmental health information. But I've got a lot of folks on my team who sort of feel like PDFs are what we need, that it is the hammer for every nail in terms of making information available. So, what are maybe just 2 points on that they could make to help make the case for we need to have some open data here on this, on information that we publish to the public.
Sure. So there's a long history of the use of PDFs in government, but it actually originated with many of the same principles that open data seeks to achieve. And so people were releasing documents and other things in PDF form simply because there was a free tool that people on the other end could download to look at these and not need to have Microsoft Office or some other proprietary software installed. We then moved to this idea that because PDFs can't be modified, that they then represent this sort of lockdown official version of something. And so the reality is you can actually do both, right? You can publish your information in a PDF on your website so that you have that comfort of like, hey, this is the official piece of information that's here that's unmodifiable, and you can always have that to point to. And then also right next to that, publish whatever's in that PDF as open data so that you kind of can meet both objectives through that.
Great. Thank you for that. And then you also spoke to, I thought it was a really interesting slide where you were talking about the value of data increasing over time, but also increasing with use of that data. And sometimes I feel like governments are a little concerned around, well, who's going to use my data? Or, gosh, they're downloading it every day. And yet, the information you put forward demonstrates that this is actually a really promising and good thing, that your data is being used by multiple stakeholders in that information, right? And so it made me think about, well, for the people who are thinking, I might be the person in my department, I might be the person in my team or my town or my county to make more data available. What do you feel like that does to their value as a professional in government, like their professional value? That we all bring a professional value, right? But this is kind of a new skill set, especially in environmental health. So what do you think that does for folks who work on this, their job prospects, their ability to demonstrate the value that they deliver to the public?
Yeah, what I think it actually does is increases their value as individuals. And a great way to look at this is, I'll give you an example from my time in Connecticut, where we were making data available from our departments of transportation on, it was weather data, it was basically precipitation. And effectively what happened, which was surprising to all of us, is that snowplow contractors started using this data in their billing process. So they wouldn't necessarily know, when they have a contract for large parking lots or something, it's based on how much snow had fallen. And they would use, TV weather reports or something like that maybe didn't always get them data for their area. And so they discovered this and they started using it. And then it went away briefly. And there was a huge outcry from this group, right? Because this thing that was so important to them was now suddenly gone. And it was mostly a technical glitch that happened, but the sort of point being that once people start using data that's being provided by an agency, a couple of things happen. One, it creates this sort of reliance and dependence upon it. So now if you go away and you're the data expert or the person providing it, now you're going to have a whole group of people on the other side that are upset. The other issue is there's still not going to be experts in the line of work or line of business that most of the people are on this call are involved in. And they're going to want to ask questions or maybe understand issues deeper. And so they're still going to rely on generally the sort of professional expertise. Now, this may create an uptick in some of the phone calls and emails that people get initially, especially after releasing some data, because you may get some questions on it. That's why metadata is important as well. But I think what it speaks to is that there's a degree of professionalism and a skill set that goes into even collecting this data and interpreting it and using it to begin with. And then when other people are looking to use it, they're going to rely on that expertise to make sure that they're using it in a way that makes sense.
Thanks. Yeah, I've certainly seen where, to your point, where folks cry out if, users cry out if they notice that the data is missing or broken. They wonder, what happened to the person who was managing that data, right? I think it creates really interesting connections between the public you serve and being in government yourself. It's interesting to know that there's essentially this growing demand from the public and support for those roles because this data is so increasingly crucial. So I think it's really interesting point to think about. And then for folks who are like, okay, Tyler gave a great presentation, I'm sold, I want to make more information available from my environmental health agency, but we don't have an open data portal. Where are the kind of lowest hanging fruit to start? How could I have like a as we would say in tech, a minimally viable product to sort of put out some data or pilot or experiment with making some of my environmental health data available? Where could they start?
So I think one is just starting with their own webpage and creating, a new webpage called Data, Open Data, where you load these data sets on there and give them a title and do that. If that is more of a struggle, a really, really simple thing to do is something like using a Google Drive and Google Sheets. And you can do that in a couple ways. One is you just create a drive on there and you upload some data sets in there, and then you create a Google Sheet that sort of outlines the URL, where it is, where to get that data set, give it the name, the description, and you can link to that from your webpage. But ideally, you want to get it out. I think people would feel better about it and like it's more reliable if it were simply on your agency's sort of website in some capacity. Again, as a comma separated value CSV, if you're working with Excel, it's as simple as file save as, and you can put it up there.
Yeah, so they're just going to save it as a CSV and load it onto the website, or if that's not an option for them, that they could use even like a free version of Google Drive, start a Google Drive account for their team, and put CSV files or Excel spreadsheets or these sort of things on the files up there. So that's a really good and very accessible, low cost, low time investment starting place. So thanks for that. Well, we're going to turn it over to more Q&A from the audience from here. So if you have some questions for Tyler, put them in the chat. Let us know. And Maddie and I will be selecting questions from the audience. I hope we can get to as many as possible. And we will join you back live for the Q&A. Thank you all for watching. And this is one of our first videos in a 4-part series on open data and open data standards. We will be discussing, as well as in this video, after this video, we'll be also discussing third-party use of open data with Sasha Anderson from USA Facts. We will have Waldo Jaquith, who is also from the Beeck Center, talking about how you purchase and kind of contract around your own technology to make sure that you have access to your own data and can open it. And finally, Chris Metcalf and I will be talking about the data standard that we developed for NEHA and CDC on the aquatic data standard that's based on the Model Aquatic Health Code. So we're looking forward to talking with you on all of those. And it's really a package to give you some great foundational knowledge on open data specifically for the environmental health sector. Thanks so much, and we'll talk with you soon.
All right, great presentation, Tyler. Thank you so much again, and great seed questions to kind of start off our audience Q&A. So Sarah will now moderate the additional questions we've received throughout the presentation.
Thank you, Maddie, and thank you again, Tyler, for the great presentation. So we've had a few questions come in from the audience, and I just want to say, feel free to throw out some more. We've got some time here to go over 4 or 5 questions, I think at least. I'm going to kick it off with a question from Tim Callahan, who, as I remember, Tim also served on the informatics committee for NEHA. So thank you, Tim, for joining us and for your great question. Tyler, Tim asks, most of the folks in environmental health are not well versed with the terms associated with open data, such as metadata. Additionally, very few have any significant experience with queries or data set management. How can we expand this knowledge and capacity across the US in environmental health? What are your thoughts there?
Yeah, that is that's a great question, and you know, in fairness, I didn't at a point in my career I didn't know what metadata was. I didn't know a lot of these terms, and I think a great place to start is by actually taking on a simple data project, for lack of a better term. So, you know, I think if you are working in, let's say, a local health agency, and I think a lot of people actually kind of get their feet wet with this by say, I'd like to make a map of all of the failing septic systems or something like that that are located in my district. And there are some tools that exist to make that relatively easy to do, but I think it starts with trying to work with some data and understanding and kind of facing the challenges that come across by trying to do that. It's okay to try to make a map and not be able to do it, and kind of like learning what the challenges and issues are. And there's so many sort of like online communities where people ask these questions. I don't, you know, it would be too many to list, and some of them will require a higher degree of sort of technical acumen to interact with. But I always say it starts, most data problems are solved or aren't discovered until you actually start working with data. But this is not a unique issue in this particular community. Metadata is not something that a lot of people put a lot of emphasis on or take very seriously until they recognize, oh boy, I'm trying to work with this and I have no idea what any of this means. And now I see why something like this is important. And then I'll just sort of add to this that there are, it's sort of a concept of data literacy, which we're seeing growing more in terms of popularity. So for instance, I'm here in Connecticut, we have a nonprofit group who does what they call like a data 101 to help sort of educate groups. And I suspect there are some other resources out there like that. So there's definitely an education component that needs to happen. I think you know, maybe a great place for like NEHA would even be sort of like a glossary of these terms so that people can leverage those and start to understand what they mean.
Great, thank you, Tyler. And I would add to that, you know, we're trying to build that data literacy through even this whole session of webinars that we're hosting. We're really excited to have experts like you on to help us break down for the environmental health community how they can get started, and terminology and all of these different things. So we're really grateful to have you here in our series of speakers that are coming up. And you know, I'd encourage, you know, Tim and folks on this webinar, if you found it useful, if it started providing some foundational knowledge, please share this webinar. You know, it's free content, and share it with your teams, encourage others to sign up. It'll also be video content available ongoing to you and to other environmental health community members. So please feel free to share it to help us amplify this educational content as well, so we could get more base level knowledge out into our industry. I think it's so important. And moving on to the next question, we have a question from Chow Lin. He or she asks, sorry, Chow Lin, from the private industry standpoint, how do we start the process for proposing open data for categories we'd like to receive from our government agencies, such as USDA inspections, CDC, VSP inspections? So I think here we're really asking, okay, so say we are, we've got folks who are in private industry or maybe nonprofits, civil society, who are seeking information from environmental health and would like to get that in machine readable data so they're able to do more with it. What should be their approach, Tyler, in kind of asking for this information or being supportive in that process of getting more open data out of environmental health?
Yeah, it's an interesting question and something we've seen people struggle with, and I think part of it is because the conversation always is initiated by someone asking for data from a government agency, and so that can get a little murky when you don't ask for data the right way or ask for the right data. So as an example, let's say somebody was interested in understanding asthma prevalence, and they go to a Department of Health and they say, I want data on everybody in wherever who has asthma. It's unlikely that that's a data set that actually exists. However, there is like a school-based health survey which can tell you certain things about asthma, or maybe a Department of Public Health has data on excuse me, emergency room visits as a result of asthma. And so my advice is typically, one, start with the question or the issue that you're trying to better understand or analyze or whatever it is, and then have a conversation with whichever agency or agencies might sort of oversee that or might contribute to that. So as maybe an example, you're really looking to understand food insecurity, right? And so you might want to then know, okay, where are the places that accept maybe SNAP or EBT type benefits? Where are the places that accept WIC? Where are farms? Where are grocery stores? And so I think it starts with really trying to understand what the question or issue is you're trying to deal with, and then kind of understand that agency's role and what data they might have, and really do it through a conversation with them.
Thanks, Tyler. We've got time for a couple more questions here. So if anybody would like to get some advice for where to start on open data with their agency, or has a specific question about open data, feel free to drop it in the chat or the Q&A. We're watching both for questions. The next question is from Mark. He asks, is it better to provide data updates in distinct segments, for instance, each month, or as rolling data, such as January, February, January, March, January, April, etc.? Do you have any thoughts on that, Tyler, on how to be providing updates on a regular basis, how to structure that?
Yes. So I want to make sure I'm sort of understanding the question accurately, but I would put it this way. One, if there's an actual date, so October, I've already lost track of what day it is, October 15th, 2020. That's better. If you, for some reason, just have October, then it's October. What gets a little bit funky, one is like these, like a quarterly type of basis, or flagging something as being, between two dates. And the other way I think this question is being framed then is to say, how frequently should that be updated? So if you have something that is done on a monthly basis, it's best to then keep that up to date as timely as possible. So if you can't provide October's data until November, then that would be great to just add on October's data on November 1st versus like 4 or 5 months down the road. I hope I'm answering that question.
Thanks, Tyler. Yeah, and I would actually add on to that clarification on, so if you have inspections that you are publishing in open data, I've seen in my work with restaurant inspection data and data standards that certain jurisdictions have noticed that they will say complete inspections for the week on a Friday, but then perhaps their inspectors kind of take their iPad that they do inspections with home, and they don't upload it until Monday or Tuesday. And restaurants who got a great score or got a great inspection, and they know that that information is public, or say we published at Yelp or other resources, will actually be quite hungry for that inspection data to publish as soon as possible. So one rule of thumb you can apply is to detail on your description of the data set how frequently it is published and what days of the week or a specific date in the month it's published, and to be clear with stakeholders on how frequently it's published. So not just like marking up the timetables or how you're publishing it, but also making sure that it's clear to any users or stakeholders how frequently that information is published, and creating processes that help you stick to regular updates of that data. Looks like we got another question. Thank you, Samantha. So Samantha asks, are there many environmental health companies that can take the restaurant inspection reports and upload data to be available to the public? The only company I'm aware of is HealthSpace, which is used across the state of Oregon. Let me just, do you have any thoughts on that question?
I'll admit that that's not my strength. Although I've seen any number, and I just don't know the names of the vendors, but I've seen a few different solutions where some local health departments are providing, a way to like search and look up a restaurant individually, but not seeing maybe that ability to access that underlying data.
Yeah, and I would say, Samantha, I've seen some of these examples from restaurant inspection data, and our next webinar with Waldo Jaquith will provide so much context and information on this answer. I think you'll find it really, really helpful. That's next week. But for the meantime, I would say that if you are working with a vendor to maintain your restaurant inspection data, it is worth having a conversation on, do you have access to a machine readable version of your own data? And so you could publish that data any way you see fit, anywhere you see fit. That should be something that you have locked in with any contract you have with a vendor. There are vendors who do help you post open data. Sometimes that's an add-on to a current contract. Sometimes that's included in the cost of your service. It's useful to have these conversations really at any point in your relationship, but especially upfront when you're considering a service. So I unfortunately have seen examples where there are some vendors who will want to charge a premium to open up that data, and others who provide it just as a free service because they see making information open and machine readable as part of their mission and how they serve their clients. So it really depends. And so it looks like we have a few more questions and comments in there. We're right at 11 o'clock, so I'm afraid we're going to have to cut it short. Maddie, do we have any more time for one more question?
I think that if we could possibly address the question maybe via email following this webinar, that would be great. I just want to make sure we have enough time so everybody can fill out this post-evaluation survey that you will see on your screen shortly. And I just want to thank Sarah and Tyler again. This is a great presentation. You should be seeing that poll on your screen now. So thank you everyone, and we're looking forward to you joining us for the other 3 webinars in this series. As Sarah said, the next webinar is Wednesday, October 21st from 1 to 2 p.m. Eastern, and we will hear from Waldo Jaquith about how to manage your technology for better data outcomes. So thank you again, and thank you, Tyler, and you will hear from Sarah and I next week. Thank you, everybody.
Thank you.
Thanks.